Hi, this is your YouTube prep for lab number 11, PICC line dressings and urinary catheter insertions. This is the last and final lab prep for Nursing 125. Congratulations. The prep for this lab, Mosby's videos, readings, there's a handout which I'd like you to review and bring to class with you, the lab, and also review your sterile technique as we will be using that. You'll be using that in this lab. Start with urinary catheterization. You do need to have an order to perform this, and the order may be, there's several different orders that you may see. Inserting a catheter to gravity drainage, that's an indwelling catheter, that's what you'll be doing in the lab. The order may also be for like a straight cath. This is a catheter that you will sterilely put into the bladder, drain the bladder, and then remove. This can be done as needed every 6 hours, so there's very different orders that you may see. Straight cath is becoming much more popular practice in hospitals in the last couple of years in skilled care, etc. And it's replacing the indwelling catheter. So I challenge you to say, why is this happening? And what's the reason for this? We'll be discussing it in lab. The catheter itself is a flexible tube that has there's actually like 2 straws together here. On the end of it, you'll see this is a balloon that's been inflated with some fluid, and the catheter at the tip of the catheter, you can see there's a little hole in it. You can see the hole over here, and that's in the side of the catheter where it actually will drain the urine. In this schematic, there is a leg bag attached to the catheter itself and is secured to the leg. And you'll see other gravity device drainages that you'll be reusing. We'll have some in the lab for you. This slide just shows you that catheter sizing. They do it in French sizes, and I don't know where this originated, but this just gives you an example. If somebody says, "I want you to put in a 16 French catheter," that's the way it's going to be labeled. And you can see the lower the number, the smaller the catheter, and as you can see, the larger the number, the larger the catheter. You will be using probably more in this area here, anywhere from 12 to 16 to 18. Those are more common sizes that you'll see in adults. So just let you know, that's how you can determine what size of the catheter. You can see some pictures here. Catheters used to be latex, but now they're latex coated with silicone, or they're other types of components. Again, here, this is the balloon. You can see the tip, and this is where you would put the fluid in. This is where you would connect it to a gravity drainage. The picture here is of a straight cath. There are some folks that have like a neurogenic bladder. They're unable to void on their own, and they have to cath themselves intermittently. So that is a stiffer catheter, and it does not have a balloon in it. They insert, they drain, they take it out. This is what we call a red rubber catheter, and this is your typical straight cath that you would see in a facility, and this is something that does not have the balloon on it. Again, you sterilely insert and drain and remove. The top picture here is just an example of different types of catheters, sizes. You can see the different colors, connectors, and that sort of thing. So there's all different types out there, and this is just to give you an idea of what you'll be seeing in your practice. Indications for indwelling catheters are if somebody has urinary retention, is unable to void on their own. If someone there is a reason to do a very strict monitoring of intake and output, such as a very ill patient in special care, or for example, preparing for a surgery. Sometimes the catheters need to be put in. We may do them preoperatively. Again, you may see much more straight caths in the future for this. Catheter care, I know you've done your videos for this, but I just wanted, there's a couple of things that I think are really important that I've seen in practice that I just really don't like. Always keep the collection container below the level of the bladder. You do not want backflow of urine back into that bladder, and always secure the catheter to the leg to avoid pulling and damaging the neck of the bladder and causing pain. Assessment always includes checking the catheter and collection container for any kinks or leftover clamps that have been left on there. So please be cognizant of this, and it's good practice. It's just plain good practice. Okay, the second part of our lecture is PICC lines, peripherally inserted central catheters. They are, and here's pictures. This is a dual lumen, in other words, two lumens. You can infuse two things at the same time, and this is a single lumen over here on the left. There's certainly different types of these catheters. Indications used for antibiotics, blood products, long-term fluids, if somebody has to have frequent blood samples. These lines can be left in for anywhere from a week or so up to a year. People go home with these, they live with these in the community, and they can also be used for short-term therapy when IV access is difficult. Your responsibility as an RN is to maintain sterile technique when you're doing the dressing changes. You need to check with your facility as far as what their procedures are, what equipment that you need. Check the indications for the dressing change. You want to make sure that it is clean and intact, and it is not loose, moist, bloody, that sort of thing. You want to because this is a great medium for microbes to grow. Dressing supplies could be, for example, here, could be just about any. They're very different kits that we'll have. You can see that there's a variety of devices here. The big thing is that you will be wearing using sterile technique, wearing a mask. Here, this is a bio patch. This has been impregnated with some antimicrobial solution such as chlorprep, and this does help keep the site clean. Check your facility's policy for that. And the transparent dressings are great on these sort of devices. Okay, for the lab itself, you'll be performing a sterile insertion of an indwelling catheter and to gravity drainage. We will have stations where you can actually get your hands on different devices and catheters to familiarize yourself, and then you will perform a sterile PICC dressing change. This is going to be a busy lab, so come prepared. Make sure you bring your volume 2 of your Wilkinson. Dress appropriately to perform sterile procedures, i.e. having your hair back, no clunky jewelry, and that sort of thing. If you have any questions, by all means, give me a call or shoot me an email, and I look forward to working with you in lab. Thanks.